everyone. I'm Richard Knight, President of the American Association of Kidney Patients. I'm a former hemodialysis patient and a current transplant recipient who has proudly worn several other titles, including father of two great kids, soccer coach for the Boys and Girls Club, a lecturer at a historically black college and university, a legislative director for former Congressman Gary Franks, and liaison to the Congressional Black Caucus. Because of investors, innovation leaders, and private sector pharmaceutical teams like the Chinook team, who work hard to develop life-sustaining therapeutics, I have been able to live a full life outside of what many simply label a patient. Today, I thank Chinook Therapeutics and every employee for their support of AAKP and all kidney patient health consumers, not only through this month's employee donation match campaign, but for your willingness to serve a purpose larger than yourself and for your dedication to work towards improving the lives of 850 million individuals worldwide suffering from kidney diseases. Your contribution is invaluable and go towards supporting the efforts of the AAKP to ensure that patient consumers are at the center of healthcare and decision making. This is National Kidney Month, and next month is National Donate Life Month. On behalf of AAKP and all patients, I thank you. AAKP is dedicated to improving the lives of long-term outcomes of kidney patients through education, advocacy, patient engagement, and fostering of patient communities such as support groups. We fight for early disease detection and the appropriate diagnosis of rare and genetic conditions, increased transplantation and preemptive transplantation, full patient choice of either in-center or home dialysis, protection of the patient-physician relationship, promotion of research and innovation, including artificial implantable and wearable kidneys, and the elimination of barriers for patient access to available treatment options. We are heavily engaged with federal agencies, including the Food and Drug Administration, the Center for Medicaid and Medicare Services, the Center for Disease Control, Department of Defense, National Institute of Health, and the Veterans Administration. We're also founding members of the Kidney Health Initiative. AAKP respects and honors all individuals who are involved in the fight against kidney diseases. Our patients know firsthand that professionals in the pharmaceutical industry and are our natural allies, because without their commitment to innovation and inclusion of patient insights, our treatment choices would be limited and the quality of our lives would be greatly diminished. It is indeed an honor to lead the largest and oldest fully independent kidney patient organization in America. Since 1969, AAKP has been a patient-led organization driving policy discussions on kidney patient consumer care, choice, and treatment innovations. By 1973, patients had collaborated with U.S. Congress and White House to begin the American Dialysis Coverage, and that is known as the Medicare ESRD, or End-Stage Renal Disease Program, for any person suffering kidney failure. This was a taxpayer effort that has saved 1 million lives throughout the years. Over the past decade, AAKP patients have won many victories. In 2013, AAKP patients advocated for congressional legislation allowing HIV-positive organ transplants for HIV-positive patients. In 2018, AAKP established the largest U.S. kidney voter registration program, Kidney Voters, and created new job protections for living organ donors from the U.S. Department of Labor. In 2019, AAKP patients were instrumental in the creation of new patient-centered policies via the White House Executive Order on Advancing American Kidney Health. And most recently, in 2020, AAKP patients raised their voices to gain lifetime transplant drug coverage for kidney transplant recipients. But with all those notable successes, tremendous work remains to be done. And your investments in our missions will help us accomplish that together. As a kidney community, we should take heart knowing that united. Together in purpose, we have shared intelligence and capabilities to drive many more innovations and save many more lives. With expanding collaborations with the patient organizations globally, AAKP launched the Decade of the Kidney. In 2019, we did this to support a patient-led international consortium to drive kidney disease as a global health priority and to better align government regulatory and payment policies so that barriers blocking rapid entry of treatment innovations in the consumer markets are removed. Today, I am proud to say we conduct the largest patient-led global summit on kidney disease innovation with the George Washington University School of Medicine and Health Sciences. In 2020, the summit engaged over 20,000 professionals and patients in 70 countries. Every patient life matters. I know that personally. So again, thank you as allies for what you do each day to push innovation and life-saving treatments forward to patient consumer markets. You should each feel quite proud about the larger cause you serve.